these same site type access, like the walk-in clinics, again, they're convenient for folks. They're much lower cost than emergency rooms or even urgent care. So that's important to them, and they could be turned around and treated and leave, be on their way again pretty quickly.
BusinessJournalDaily.com. 3 Minutes With is brought to you by Farmers National Bank.
So there's three levels, really: primary care, urgent care, and I think that's where a lot of confusion lies between primary care, we call it walk-in care, and urgent care, and then emergency. So emergency, obviously, life-threatening, you're having a heart attack, car accident, something of that nature. Where urgent care is a step down from that. It's a little less costly, middle of the road cost, and that's where you go for something like a fracture. It's a definitive fracture. You broke a wrist, broke a leg, or there's a laceration that requires stitches. And the most common venue, the one we've really grown and developed over the last several years, is really that walk-in care, which is primary care extended. So it's primary care without an appointment. We have multiple locations, like you mentioned, WIC Primary Care at YSU being an example, where that's, you have a sinus infection, you have a flu, you have something that's not life-threatening, doesn't require stitches, something that sprain, strain, things of that nature. We could go in and be seen right away without an appointment, be taken care of very quickly, just like you would at your doctor's office, and have that same low-cost experience where the only cost to the individual would be that same copay that they would pay if they went to see their primary care doctor.
How have those walk-in clinics, how has their use shifted, or are some of them still serving that same role while others have been more dedicated to things like flu to COVID?
We still have those walk-in sites. So if you have a non-COVID issue and you're ill, you have a sprain, you have something in your eye that needs looked at, allergic reaction, we still have our walk-in sites. And an adjunct to that, what's developed off of that, is our flu clinic. So we've developed and continue to have, and probably will be, I'm guessing, probably until summertime, 3 flu clinics. We have one in Columbiana, we have one at WIC still, and one up in Trumbull County in Vienna presently, and those are specifically for COVID symptoms. So we still have those walk-in sites when the majority of the issues people have are not COVID related, and they still need that care. They go to the walk-in, or they could go, if it's more flu-like, onto the COVID. And then probably the latest adjunct off that in the past year has been virtual visits. So now a lot of times you don't need to go in to be seen, because there's a lot of conditions that could be treated virtually, just like we're doing on Zoom. And that's become something that's been a staple now for most healthcare providers in the past year. And I would imagine you're going to be here permanently.
How did the operation side change for the clinics that you designated for people with COVID-19 symptoms?
These are new sites or new locations specifically for COVID. So figuring out, how do we go about doing it? What's the need? Where do we place them? What are the hours that are most convenient to people? So evenings, weekends, and the like. And how do you staff that while still keeping your other operations going? So how do you have a provider, whether it be a doctor or an advanced practitioner, along with all the adjunct staff and support staff, to do that while keeping your other sites open? And then you have to do all the additional precautions at those from a PPE standpoint, and the testing equipment, and obviously the separation and the cleaning. And at the same time, all the sites that remained open, you still have to take those precautions where you limit waiting room space, make sure people are wearing masks, temperature checks, cleaning thoroughly. So all those things. So it was a lot of pivoting, but we thought it was best to specifically have COVID sites that are designated just for those purposes, and separate that out from individuals who have other healthcare needs.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit BusinessJournalDaily.com. For all of your arts and entertainment news, go to AfterHoursYoungstown.com.
BusinessJournalDaily.com. 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.